thank you all for joining this important conversation today on the crisis of homelessness here in King County. This event is a part of the WTIA Policy Speaker Series, which brings together leaders, experts, and policymakers on a quarterly basis to lend new insight into timely and important issues in our state. I'm honored to introduce our two speakers. First, a person who needs no introduction, but I'll do it all the same. Marc Doanes is a social entrepreneur, policy strategist, and social justice activist who has dedicated their career to equitable systems transformation across local, state, and federal governmental systems. We're lucky to have them with us in Washington, where they have been at the helm of the King County Regional Homeless Authority as its CEO over the past year. Prior to this role, Marc has served in leadership positions across academia, social justice organizations, and state government. They're a truly innovative thinker and doer, which is a rare combination. Thank you so much, Marc, for joining us today. Marc will be talking with Neal Myrick, who serves as the global head of the Tableau Foundation. Neal has spent his career at the intersection of technology and social impact. Since founding the Tableau Foundation in 2014, Neal has led the company's work to impact social change, while also leveraging the power of data to solve some of our most intractable problems, from racial equity to chronic disease and education to homelessness, which is what we're here to discuss today. Prior to Tableau, Neal has worked across innovative technology companies, consulting firms, and nonprofits. He's also an active angel investor, volunteer, and nonprofit board member, as well as a philanthropist. We're delighted to have him here today. We will save some time at the questions for audience Q&A, so please feel free to put them into the chat and we'll get to them at the end. Thank you both so much for joining us, and Neal, over to you.
Thank you, Molly. Hi, Marc. Good to have you on the call. Good to have you here. I thought as we got started here, what might be really great is to help people get to know you a little bit as a human being before we dive into the business questions. So could you tell us a little bit about like what your background is, and then, you know, what drives you to do this really important work on homelessness?
Sure. Thank you for having me. It's nice to be with you all. I'll start with like the boring sort of resume stuff. I have a degree in psychiatric anthropology. I've spent well over a decade now, primarily in the public policy space. I characterize my career as sitting at the intersection of like public health and X, whatever the X is for the time. I started off doing a lot of work, very focused on youth violence prevention. I've done a lot of work on youth homelessness. I've done a lot of work on substance use disorder and treatment. And then for this last 5-ish years, I've been predominantly focused on homelessness. My work has always sort of really been founded on the premise, I think maybe because I'm an anthropologist, that you can just like ask people what they need, and then you should like build that, and like then it'll be fine. And like and that the like sort of like consistent you know, sort of stress testing of like, or means testing, depending on the language you want to use, of like you know, does this person really need this? Do they really know what they want? Is like really a strange way from my perspective to approach any governance or public health problem, particularly given the stated values of our country, but that's a separate conversation. And I guess, you know, sort of why I'm driven to do this is, you know, I didn't really start talking about this as much until I was really in this role for a lot of different reasons that I'm happy to talk about today. But you know, I experienced housing instability. I often talk about my childhood as a sort of reverse Cinderella story. Like when I was quite young, we were pretty well off, and then through my teens and 20s, not so much. And I watched things get repossessed from my childhood home. I watched my mom not have food to feed us, and I also experienced housing instability in my early 20s myself, not being able to pay rent in New York City and then in Boston. And so, you know, I come to this. Oh, I also have some pretty significant mental health stuff, and that's many years in the rear view, thanks to the wonders of pharmacology, which can't stress enough. We love science. But like I was I'm an assault survivor when I was a teen, and it triggered a pretty significant bipolar disorder that led me to be hospitalized twice. So like I've tried to use a lot of this stuff, right? Like,
Yeah.
and so the personal component of like the non, like, where did you go to school? Like, what degree do you have? For me is like, I know what works and what doesn't because I've walked through some of it, and I know what the difference is between a space that's therapeutic and designed for healing and a space that is actually designed to punish you for being unwell, right? Like, and I believe really fundamentally that like if we orient our systems towards dignity, towards a belief in healing, towards that idea that people can self-determine, that we'll just get better results. And so that's why I'm here, I guess.
That's amazing. I didn't know that about you. I had heard, I think the most I had heard is that you're from the Midwest. And what it says to me, we always talk about in our work where it's important to have people with lived experience involved. So, it's amazing that we have somebody with your lived experience, at the helm of the regional authority. So thank you for sharing that. I really appreciate it.
No worries. I'm also from the Midwest, which is important.
Yes, exactly. Well, if you don't mind, I'll dive into the first question. And to set context, so I've been in Seattle since 1986. And I've had this sort of citizen's view of homelessness. And, I remember in 2005, Seattle launched a 10-year initiative to end homelessness by 2015. I remember a public radio series in 2016 with a bunch of interviews from people who, explain why we as a region weren't able to accomplish that goal in 2015. And then I'm aware of, stakeholders here in the region hiring Barbara Poppy to do an analysis and report on, why we didn't get there and what we could do differently. And then when I heard about you coming in, I was excited because I know that you were then also brought in to build on Poppy's report, do some deeper analysis, make some more recommendations. And so you have kind of a bit of a history, with Seattle preceding your new role. And then we have the regional action plan that I think was released in late 2019, 2020.
That's right.
So we've had a lot of plans, and the problem's not getting better. So I'm really interested in just hearing from you with this new plan and the launch of the regional authority. What's different now, and what gives you hope that we actually could get, some real progress made against our homelessness challenges here?
A couple things. So one, there's I think it's I guess technically it's a sentence fragment in Barb's report, who's like a dear friend and colleague of mine, and like, and we actually we first really began to work together. Like I knew her, but when I first came to Seattle to do my audit, is when we really started to talk. And then I lived in Ohio for a year in that sort of 2020 time when the pandemic was happening, and people were like, I guess it doesn't matter where I live anymore. And I moved to Columbus, and we used to take walks around this lake and talk about like, the state of homelessness in the country, and often actually Seattle. And one of the things that Barb says in that report that I think is unfortunately like very true is that the system here has, I think she uses the words, lacks a bias towards action. And so the fact that there are so many plans is indicative of that, right?
Right.
Like, and what I found in my own audit was like, any one of these plans actually could have made a significant dent, but they haven't really been implemented, right?
Right.
Like, and in part that's because of you know, what we identified as like a fundamental brokenness in terms of system fragmentation. And so one of the things that is different is that, you know, while I don't think that my style or my team style is to sort of, you know, rule via fiat, or, you know, like sort of just say like, well, this is what we're doing, and, you know, whatever you say doesn't matter. Like, we are the last stop, right? Like, we are, like, this agency is the point of departure for like, what are we gonna do, right? And we are now like the primary public funder of all things homelessness. Like, all those contracts sit here, all the, you know, policymaking authority sits here. And so, you know, some of what Barb diagnosed as that lack of bias towards action, we affirmed, and then sort of also went farther to say, and it's because the decision-making structures are too fragmented to get you to action. So that's like one of the reasons why I think that like we're in a different place. You know, I'll also say that like, there's just a resourcing problem. And I know that folks like, it's not like a popular thing to say, but I think it's important for particularly me in my role to affirm that it is like just fundamentally true. The system is under-resourced for the magnitude of the problem that we're up against. You know, the number that often floats for people is like 11,000 people experiencing homelessness. The reality is it's at least 4 times that. You know, in candor, you know, the system generates about 6,000 exits to housing per year, and we run about 5,000 shelter beds. So if we were dealing with 11,000 people who needed us, we actually could do that easily, right? Like, that is that we wouldn't be here. I wouldn't have this job. But it is because it is a scale of 4 times magnitude, and we're not resourced appropriately, that we just keep sliding deeper and deeper into that hole.
Wow, that's really interesting. And that actually makes a lot of sense, given, because there are those times you hear the numbers and you're like, well, they're big, but they're not that big. And why is it such a problem? And yeah, that's really, really interesting. You know, I'm wondering kind of with the regional authority. So I was thinking about you over the weekend, and I thought, you know, he's been here a year. And a lot of the work that has to go into, you know, building out that organization is hiring people, processes, technology. So a lot of the stuff you have been doing is not sexy and not newsworthy. So I have kind of a 2-part question for you. One is, how is all that going? Mm-hmm. And then the second question is, you know, you did have a big accomplishment in the $10 million Partnership for Zero initiative that was launched. So I'd love to hear a little bit more about that as well.
Yeah, I appreciate that, because I think many folks who have not like run, and this is I've run a bunch of departments, and this is my second go round of running an organization, and actually my second startup. Many folks, I think, don't appreciate how absolutely boring but deeply essential, like, you got to build organizational infrastructure. Like, my very first day on the job, I was, which was April 26th, 2021. So it is almost a year to the day. My very first day on the job, I spent figuring out how to get an email address and then using my personal credit card to set up a Zoom account so I could have meetings. like that. I mean, that was the level of startup, right? Of like, there was zero infrastructure. And I think that, you know, people have this assumption in some spaces, right? Because we are the government, that we just sort of inherited all that government infrastructure, but we did not. And so it's going okay. We are currently like 57 people work here, which is amazing. Going from like 1 to 57.
I was going to say, so you've hired 57 people in 12 months, essentially. That's a lot of work in and of itself.
Thank you. It has not been easy. But I feel like we have an exceptional team, and we've been able to build out really quickly. Some of those core infrastructure components. There is we're re-implementing contract management. That is hard. There's just like a lot of that stuff that is happening. I feel good about, and it cannot be overstated, like how much work it actually is to get that stood up, right? Absolutely. I think that we are in a really exceptional posture for a startup that is a year in terms of again, the staff capacity, the kinds of systems we've been able to stand up, where we are in terms of our sort of next iteration of sophistication around those systems, and the thoughtfulness that's going into it. I was talking to my deputy CEO and chief of staff today, and I was saying, I've got a year in, I see where there are problems, and now I've seen enough to be let's move these things in this way, right? Gotcha. So I think that's going really well. On the partnership component, I'll say, one, just super grateful for our partners that we are in, and our broader philanthropic community. I think that for me, the thing that's huge there is, that was a focused catalytic gift for a population we are not actually normally able to raise that much money for, right? Because the conversation that I have been having is about our chronic single adult population. Those are the folks who, while they often, frankly, are at the core of much of what people feel as the community level disturbance, most of the time when we're able to generate philanthropic gifts, it's around young people, families, right? And in candor, it's the populations that you can put a warm and fuzzy around. And while I think no gift is a thing to turn down, I also think that if we really are going to do this work, if we're really going to get out from behind this 8-ball, we also have to be able to generate the revenue and the love and the compassion for people who are not as cuddly, so to speak. And I will say that one of the things, and going back to sort of why am I here and why do I do this work? I really do believe that again, systems can be oriented towards healing, and they can be oriented towards how do I have a colleague who works here at the authority who says my job is to love people back to life, right? And I deeply resonate with that. And one of the things that I often think about is there's a place called Bergen, New Jersey, and they have ended chronic homelessness. And their administrator often talks about how the last person who they had to help inside was someone who was just kind of a mean person. and he would hang out in the middle of the town and just say mean things to people. And it wasn't because he had mental health issues. It was because he was kind of a mean person. And they talk about how, and we just we didn't let up. We as a community said, okay, it's still not okay that you have to live outside, right?
Right.
And so I think that this gift, I hope, represents the beginning of that journey, right? And the beginning of that kind of understanding that what we need to do is lean into even the people who are rude to us, right? And that the system has to believe in the basic dignity of everyone, full stop.
Yeah.
And the work in terms of activating that gift is going really well. We've hired 4 system advocates, right? Those are the folks who are going to be working with folks who are experiencing chronic homelessness to help, build pathways inside. We posted for the jobs that will report to them. I believe interviews are going to start, I think, next week or the week after. And so, really by June, you should be able to be downtown and see people who work for the authority working to triage and support people who are experiencing chronic homelessness in the downtown core on whatever their journey is inside.
Yeah, that's amazing. That's amazing. One thing that I know far better than I do in all the work you've done in your career is that none of this type of work is without controversy. I'm interested in, I think I've heard there's a bit of a difference between sort of the regional authorities' perspective on sweeping encampments and what the city's approach is, especially sort of in the downtown. I'm curious just to hear your thoughts on that. And personally, I think those kinds of differences are okay, and we're going to have more of them, but I'm really interested to hear what a professional person says about that.
I think, yeah, no, it's frankly, I will say, like, just briefly, it is remarkable because when I started this work, it was like what, in like 2010, 2009, homelessness was not a political issue at all. Like, no one paid attention. We would often fight for the attention of electeds, frankly, to be like, can you look at this long enough to maybe appropriate some money toward it, right? Like, and it is remarkable to me that in, the 10 plus years time, that it has become what it has become. And frankly, I see that as indicative of the level of failure in our housing markets and in our basic support services that should have prevented this from, this is aberrant. This is not like what we see when we go outside it's not what happens in a functioning society. I'll say
Right.
that. But so to your question, I think that our position is pretty straightforward, that just what we call displacement-based strategy is not something that we support because it is not evidence-based, right? Like, we do not see the return, right, on that activity, either in terms oftentimes of frankly disrupting some of the behavior patterns that folks might be concerned about, or certainly not in terms of helping folks to come inside. So like, from that perspective, it's very straightforward for us. Like, that's not an evidence-based practice. It literally says in our authorizing legislation, use evidence-based practice. So like, that's not, we would not be supportive. What I do think, though, and to the point around controversy, is like, because I'm from the Midwest, I'm just kind of like, I'm just gonna like that statement is my statement. Like, nope, it's not evidence-based. Like, I don't have a lot to say after that. And I often think that people are looking for me or our team to call people mean names, and like that, I don't think that's helpful, right? That doesn't do anything. And I actually think that, like, we have been able to have some very productive conversation with Deputy Mayor Tiffany Washington, with the senior team at the City of Seattle, about how do we align to hopefully generate a non-displacement based way of engaging with encampments that are causing concern. And I think that, to me, is where I would like us as a community to focus more, because I think that where we get lost is if we say, well, what are we doing today about this thing that is troubling? And we start looking at tactics and they proliferate, and then we start fighting. What I'm really focused on, what I'm asking our team to focus on, is how do we identify an outcome we want to see and walk backwards? Because those conversations are often extremely fruitful. It's very easy to be like, okay, well, we all actually want the same thing. And then we are able to say, and here are the evidence-based strategies we can use to get there. Here are the resources we've got. Here are the gaps we have. And I think that, I really do think that we're in a pretty good place in terms of beginning to move towards a more aligned vision of how to do that work. I also think that, like, and Deputy Mayor Washington and I are, we've known each other for a long time, actually. And so, I think that she would say, and I've heard her say, she and I have different jobs, and
Right.
And that is also okay, right? And I have more than enough respect for her as a person, and to know that, like, what she's very focused on is ensuring that the sidewalks and public spaces and rights of way are navigable, And I'm very focused on making sure that people get inside. And like, those are different, and that's okay. And so, but our job as two leaders in the community is to figure out how we can make our strategies align as much as possible. And I very much think that that is in flight, and something that I hope that we'll be able to talk more concretely about, like in a week or so.
Awesome. That's amazing. And you know, actually what I, just as a longtime citizen of Seattle, what I love about what you just said is, you know, you gave your position and you said, that's my position. I think one thing that happens in our region a lot is a controversy comes up and then we burn time trying to resolve the controversy when in talking about the controversy versus just saying, here's our position, we're moving forward and getting our work done. So I love that as a citizen of the city. So thank you. All right, so you mentioned Bergen, New Jersey, and the person who was mean. I take it that you knew his name. And I know from the work that we've done in homelessness around the US that by name lists are a really important tool for you know, functionally ending homelessness in many cities. I was really excited to see when I saw a job position posted for, I think it was a director of by name list or something. And I'm a data guy, so talk to me about data. What role does data play? Why are these by name lists important? You know, give me the spiel.
So love data as an anthropologist and a you know, a person who considers themselves a social scientist. I often, you know, one of the things I often say to our team is like, I don't know, I just feel like we should make decisions based on stuff we know, and like if we don't know it, we should find out. Like, and so like a couple things for me. One is like, you know, just going back to the thing that we were talking about before, which is like, we need to know how many people need our system, right? Like, and laboring under the notion that it was 11,000 people when it's actually closer to 45 and maybe a little bit above, that's a huge problem. And it results in a narrative in the community, like, look at these inept bureaucrats or look at these terrible nonprofits. And that's just not true, right? Like, everyone is working incredibly hard every day, actually to a high degree of success. We just don't have enough of the things that we need in order to do our job to the level of efficacy that the community needs us to be able to do. Yeah. So I think, like, you know, just the basics of like, what are the numbers feels like a really important thing for us to be focused on from a data perspective. But I think, you know, to your point, like, we need to go past that, and we need to, it's a by name list implementation manager or director, I think is the position that you're talking about. Yep. And so what we are, and on that project, we've actually partnered with Microsoft to begin to explore, you know, what it would look like to create a tool that is useful at all levels, right? So, and when I say that, what I mean is like, I believe that granular, like high quality granular data is only possible if it is useful to me, the person whose data it is, to provide it, right? And what we, our Deputy Chief of Community Impact, who oversees a lot of our data work, or that division oversees a lot of our data work, I should say, Owen, often talks about what he calls the data tax, which is like, we essentially ask people for information at all of these different points, right? And it doesn't actually yield better service. It just like, we've just like taken information, and like, it may or may not even be useful to us as administrators, right? So when we're talking about a by name list, what I've been saying is, we don't just want to know the names of folks. We also want to know where they are, what they need, who they're talking to, you know, is that working, right? Like, and to be able to, via a platform that is coherent and consistent across a number of provider and government spaces, say, here's how we are best supporting this person, right? And what I often liken it to is my chart, right? Like, so, you know, we all, you know, if we are you know, seeing any sort of physician regularly, even annually, which, you know, I shout out to medicine, you should do that. You're engaging with an electronic health record system, right? And my chart is now one of the most common. There are others. But it's a way that you manage your information. You can send things to people, you can revoke access, you can message all kinds of providers, right? Like you can move your records across multiple providers. And what you may not even realize is in that you are providing the administrators of those hospital systems with a lot of data about what does or does not work for you, about where you are in treatment, and they are then using that to tailor better services and supports.
Right.
And you don't even feel like you're giving up a lot of information because it's being used to support you. So that's what I think we need to get to when we talk about by name list, right? Is like not just the names, but really an expansive data ecosystem that has at its core a customer centricity that again, like is focused on dignity and the idea that people know what they need, and our work should be to support them in activating that.
That's amazing. Yeah. And I think that, I think we've talked for many years about how oftentimes, and especially in the nonprofit sector, the definition of customer is wrong in the sense that oftentimes the nonprofit is trying to serve the funder.
Yes. At
the expense of the constituent, and not intentionally or anything, but it's just the way the system works. And we, we're 100% behind that view of, if you collect data, it needs to be able to be used by and for the person that was collected from, to benefit them. So absolutely love that perspective. Do you have something else you want to weigh in?
I was going to say, like, I just think it is worth interrogating. Another conversation, a different day for all of you watching, like when, over whatever beverage you drink in the evening. Like why it is that so much of how to solve homelessness is known, but is conserved as a privilege to be deployed for folks who are middle class or wealthy, as opposed to the best way to optimize service, and so should be deployed everywhere.
Right.
And from my perspective, I believe it is because there is an underlying contempt that we have for poor people broadly, not just folks experiencing homelessness. And until we as a culture move past that contempt and move past the question of why do these people deserve this, and instead just like, well, they deserve it for being people, we're gonna be a little stuck.
Yeah, that's a really great point. Really great point. And I think, what's interesting is I think that type of thinking really weighs into public policy, right? And you're a policy person. And one question I had is when you think about the problem you're trying to solve, right? There's housing affordability, zoning, housing policy, all these public policy elements that play a role in affecting, how we can help people experiencing homelessness or prevent people from experiencing homelessness. And I'm curious, with your new role in the regional authority, how does that sort of fit into influencing and helping drive policy at a larger level?
So in our legislation, we're expressly asked to advocate for more affordable housing. And so here's my plug. We need more affordable housing. We talk about it all the time. And we are not, our role is what's sort of commonly referred to as the crisis response system, which people can think of as like, diversion, shelter, to some degree, some parts of permanent supportive housing or other forms of housing. And I think that there is a strong need, I think, to reimagine sort of what some of that crisis response system looks like. But in order for us to really stabilize the region, we have to, admit, and then, going back to what I was saying before, have a bias towards action around solving the housing problem, right? And some of that is going to be, and maybe this is more of the Midwestern, like I'm just going to say a thing that, might be controversial. Some of it is going to have to be saying like, yes, some single family zoning will go away. Like, sorry, like, I don't know how else to have this conversation other than to say like, and I feel that way oftentimes in terms of like, when we talk about like, frankly, even wealth distribution, where it's like, if we are trying to think about like where there are concentrations of wealth or concentrations of access or, whatever it might be, there is a conversation there that must also be had there as if we say concentration is bad, then redistribution is like literally what has to happen, right? And
it's no mystery, right?
It's not mysterious. And when we try to talk around that and create these policy versions of a world where you can sort of have your cake and eat it too, I find that baffling, and ultimately it undercuts progress towards where we need to go, because I don't know, I think it presumes that the voter is too dumb to realize like what the conversation actually is, right? Like,
right.
And like, we know that if we're going to, transform the housing market, that's gonna require very different investments in multifamily, in density, in transit, in the things that we know support having enough spaces for people to live in at the right cost. Right. And like, that just has to be the conversation that we're having. And yes, there are some people who are experiencing homelessness right now who have, behavioral health or substance use issues. They are not the majority of people. The majority of people just don't have enough money to access housing in our market, right? And so those things have to be corrected if we're going to see a long-term end to homelessness, or like we will continue to see a crisis response system that only grows, right? And I don't think anybody wants that. Right. I certainly want that. So, from my perspective, we have to be having those conversations. This agency is not designed to lead it, but we are chartered to play an important advocacy role. And what I would say is that, those conversations around, and I want to bring it home because, I think everyone is sort of pro density until it's their neighborhood. And I want to bring I guess the reality that we need to start having, again, at the block by block level, a conversation about what would it mean if my block had more density on it, right? Like I live right now in a very little townhome. I want to be clear about the scale of the house I live in. But it's just my partner and I. And there's a new apartment building that's being built on the corner, and I'm delighted. Like it's great, right? And there's transitional housing for vets that's around the block. Amazing. So there is and to be clear, people don't even notice, right? It's fine. Right. And so I think that we just have to begin to say, it's not just good in theory, it's good on my block. And what we are actually afraid of are things like, bad design or, things that don't have the right service supports around them. So let's have those conversations. Let's have those conversations with clarity and thoughtfulness, and not some of the other conversations that I hear.
Yeah. I mean, just what you were just saying, all of those thoughts really, it reminds me of kind of where we started with the conversation, which is, I feel like we've known for nearly, for 20 years what it would take to end homelessness in Seattle. We just haven't been able to make it happen for various reasons. And I think, we know today what we need to do to solve homelessness. And it comes down to actually just implementing, I guess. I mean, I know that's a way oversimplification, but it's amazing that it's taken so long, and we've had such a hard time. I think we have maybe time for one or two more, and then we can open it up for a couple questions. And actually, Nicholas asked a question which sort of gets to something I was going to ask you, which is, what do we need to do as citizens? How do we communicate with our elected officials about this, and how do we help them help you?
I have a couple incredibly boring answers. I'm sorry. The first, and honestly most important is please come to public meetings and support things. Like I just like, I know that sounds like just like, well, why do I want to do that with my time? And the reason is because the people who are currently showing up are saying a lot of things that are a little wacky. I've been using this example a lot because it is now seared into my memory, but I was recently asked by a colleague if I had any papers, like academic research, that I was aware of on disputing a correlation between permanent supportive housing and child abuse. And like, my response was like, no, because it's not a thing. And that's a bizarre request. And then was told about a whole narrative that was emerging in some communities about like, oh, we don't want this permanent supportive housing here because like predators are going to move in. And I just like, you know, I don't have time to unpack all that, but simply put, we need other voices in the room, right? And what we know is that 90% of the community can be okay with something, but it's the 10% that hates it that's going to show up the loudest. And we actually need the other folks, you all, I hope, to be coming to those meetings, coming to those conversations and saying like, actually, not sure what that is, but very pro-housing, right? Like that's just really critical. Same with the zoning board meetings. Like there are just like places that we just need people to show up and push for what we know the solutions are, right? You know, and I know, again, I know that's not like a sexy answer, but it is unfortunately like the government answer of like, we have a lot of meetings and that's where we get a lot of our feedback. I see Nicholas in the chat, which level, city, county, state, or all three? All three. And like really, like I know that's like a time commitment and it's a lot. Like maybe organize your block, right? Like think about how you trade off it, who goes to what. But it really is important, and it makes such a huge difference for us who are appointed or elected to be able to say, like, actually, we are doing the thing that like our constituents want, right? Like, because that's our job, right? Our job is to manage towards what we believe the electorate has asked us to do. Yeah. The second thing that I'll say is, and again, this is like sort of a little boring, but I need folks to be part of eliminating the narrative that there are heroes and villains, right? Like, there are many people in this sector, in this movement that I disagree with. I don't think really any of them are villains, right? Like, and it is our responsibility, I think, as adults trying to solve complex problems, to hold that complexity. Yeah. And to hold space for disagreement that is not vilification. And it's, it goes back to what I was saying about, working with some of my colleagues across city or county spaces where like, we may not agree on an approach and, I may be very clear, like, hey, we don't agree. Like, but that doesn't mean that like, my next step is to, go to the media or, go to other meetings and say, and that person who is the worst person, right? Like, that's not going to get us where we need to be. And then the third thing that I'll say is, I guess, and this is again, like a little boring, but to the extent that you see an opportunity to build relationships with people who are experiencing homelessness, whether it is, through some coalition opportunities or, by, volunteering. Our shelters are very understaffed right now. We could always use more help. I think that's really helpful because I do think that like the narratives around folks experiencing homelessness have become extreme. And it is only you all, right, through your own interactions, through your own felt belief that de-escalation happens. Because when someone says something extreme to you, you can be like, actually, I don't think that's true, right? Yeah. So like, become involved at the level of supporting some of our agencies. We have a lot of folks that, post for, people to help cook dinner, people to help, support various activities, plug into that stuff, right? and more than plug in at the level of like talking to the agency staff, talk to the people, build those relationships, and I think learn what I think many of us know, which is like people aren't scary, they just don't have money. And again, like if we don't get past this societal level contempt for the poor, we're not gonna get to where we need to be. And that is a felt thing, not necessarily a data thing.
Yeah, absolutely. Yeah, really interesting. I think, when it comes to providing support for the work that you and your organization do, there's a question from Jennifer that I think I can connect in, which is, I think I've heard that sort of you're working on, I don't know if strategic plan is the right word, but how do we find out what your kind of priorities and plans are so that then we can figure out the right ways to plug in and support your work? And
Yeah.
I hate the term strategic plan, frankly.
know,
So
same.
I hate to use that, but
We're required to promulgate a 5-year plan. What I'm trying to do is make it something that is less of a like not another 10-year plan, not another and at the end everything will be done, right? Like, and more of a like, a little bit of an if then, right? Like if we have this revenue, then this. If we have that revenue, then that, right? Like so that there are like very clear expectations about like, hey, like if we coast at the revenue level we're at, honestly, not much is gonna change, right? Like and it's my job to tell you that. But so that'll come out in September.
Right. Okay.
And we'll put it on the website and all that kind of stuff. The other place, again, speaking of public meetings, so I have an implementation board meeting monthly and a governing committee which meets every quarter. Those meetings are they're virtual for now. They're all time and Zoom links and stuff posted on our website. Folks are super encouraged to attend those. And again, if there's like we always have a public comment section at the beginning. And so if you want to show up and be like, hey, like, we liked this thing, or hey, it'd be great to see this thing, right? Like, you can say you didn't like a thing, although, it'll hurt. No, I'm kidding. No, but
you
like,
never hear that, do you?
No, I never. But I do think that like it's good for our oversight bodies to hear again directly from the public, like, hey, this is like, we want to see more of this stuff, or we think it's really great that there's this, system advocate work happening downtown. When is it going to go countywide, or is it going to, that kind of stuff, I think would be a great way to stay in touch. And then the third thing that I would say, and Ann Martins, who's our senior director for external affairs, is and I think is watching this, is going to I think like come crashing through my office wall to tell me don't do this. But I will also say you can invite us to stuff, right? Like we really try not to say no to things. Scheduling is a nightmare, but we really try not to say no, in part because we want to be connected with the public and connected with folks who want to know what's up. And so like I've done like Rotary clubs, I've done HOAs. I try to be available because I want folks to have direct access to me or someone on our senior team who can explain what's going on and hear feedback or hear what people's concerns are. And again, right, like I just to be totally candid, like you may say something and I'll be like, that's not right. But at least then we are in conversation, as opposed to, you're operating under a false belief and, I'm over here doing my job and, we're never going to talk about it.
Yeah, that's fair enough. What I really like about the way that you talked about the thing that we're not going to call a strategic plan is we're always making choices, right? So if your budget is X, we're making and we decide we as a community decide that's going to be a budget, then you get the results of X. You can choose Y and get better results. You can choose Z and even get better results. And then it's not that it's failing, it's not being supported to be successful, which is a different kind of conversation, this is, in some cases. So,
Yeah.
And then I know from lots of funders supported the campaign you have downtown. I think for funders who support homelessness, then it also can give a clear picture of, if we're here and an extra 10 million or 20 million can get us here,
Yes.
it's a clearer ask instead of sort of like the crisis asks that have come over the last several years, where it just feels like we're constantly funding crisis response. It's more like, okay, if you can get me $10 million, I can go from here to here, and we can make some real progress. And I think that's a great way to think about solving the problem. So I appreciate that approach.
I'm trying to build, something that has the necessary transparency, and is also, to your point, right, like makes it clear that you can't, we can't hold our provider partners accountable for things that we have not paid enough for them to do, right? Like we have a crisis of wages right now, which is like a huge thing that's on our mind, of just like, or our minds rather, of like, we have such high turnover in our frontline staff positions that there is a quality issue, like fundamentally a quality issue, and stabilizing the workforce is a salaries question. And again, right, like, it is an unsexy conversation because it's not going to necessarily open a new building, but like, to be candid, like there are places right now that like, I'm concerned they are open and I'm concerned about the staffing in them, right? So we might lose spaces for people to be because we are not paying for enough people to staff them. And so it's that kind of stuff that like, I just want to make sure that the public can see clearly.
Yeah. I think that's a great point. And, everybody on this call, is part of WTIA. It's all tech companies. If tech companies know anything, they know about salary competition and paying people fairly. And so that sort of leads me into one of my last questions, which is, given that you have an audience of tech people and tech companies here, beyond funding, what can we do to help?
I mean, if you all want to I just discussed like a lot of tech stuff that we're trying to do, right? Like there's other tech stuff we're trying to do. So like, if you've got tech time, we have tech stuff. I think the other thing, I love the opportunity to speak with you all. And I think that like, because our tech sector is such a significant, like that is a significant sector in our region, right? Like, I would love, if you want to invite me to come speak at your company, your organization, your leadership team, whatever, again, I'm totally down to do that. And I think that the more that we are able to get the, like, what is happening, what are the roadblocks, what are the successes, like where's the what right out there, the more that we can all be speaking with one voice. But I really want to go back to that first thing, which is like, we do have tech needs. So like, if you want to help, like truly just like shoot an email and we'll be like, hey, here are the 16 things you can work on today.
Yeah, that's awesome. That's good to know, actually. Great. And I think we're about to wrap up, aren't we?
Yes, thank you so much. We're pretty close to time here. Thank you everyone for tuning in, and thank you both so much for the insightful discussion today. Really appreciate it. It's a challenge of Zoom. I'm sure everybody is like smiling and nodding and feeling really energized right now, but you can't see that. So we're really grateful for it. WTIA does a lot of policy work ourselves, and I hope we can amplify your policy priorities at the state and local levels as well. So thank you.
Awesome.
Hi, everyone.
Thanks so much. Thanks, Marc. Great to talk with you.
Nice to meet you.
Yeah, you as well. Cheers. Bye, all.